Today, we are going to try and show a topic that, from both a medical and didactic point of view, is of great importance, not only as treatment are concerned, but also for teaching. We mean multifamily groups in both psychiatry and psychoanalysis, as our title shows. Dr. Jorge Garcia Badaraco is with us now. He has created this technique. Among his various degrees, we can mention that he is a professor emeritus at the School of Medicine of Buenos Aires, a former president of the Argentine Psychoanalytical Association, and of course a noted Argentine psychiatrist and psychoanalyst. Now, as a colleague, I must say that he brought occupational therapists to Argentina. He was the man who could organize the psychoanalyst-style therapeutic community in the 60s, and he also took the first steps so that the psychiatric hospital teaching be founded in Argentina, as well as the psychiatric daycare hospital, and of course, he has created the multifamily group therapy we are concerned with today. So, welcome, Dr. Garcia Badaraco, and I launch my first question. What are the so-called multifamily groups? Multifamily groups is a therapeutic experience I started at Borda Hospital, Buenos Aires. I started in the early 60s gathering mental patients from my ward with the families, leading dialogues among them from a therapeutic point of view, a focus allowing me to open a fresh panorama for using psychoanalysis. I mean using psychoanalytic interpretation, psychoanalytic way of thinking, and a way of thinking when integrated in small groups, and the way of thinking when doing family therapy. Within a multifamily context, you can integrate the orthodox psychoanalytical thinking with both group thinking and family therapy into a broader psychosocial context, a wider group context, a fact likely to have many dimensions incorporated. In order to illustrate the topics you are going to develop during this videotape, you've brought material recorded at Borda Hospital while you were conducting a multifamily group. When did you shoot this tape? Did you know the people involved, or were there newly met people? Could you do a short introduction? I have lots of videotaped material from different times, from different years, but lately I'm finishing a book on multifamily groups, and I thought that showing some footage will help us with some aspects that are quite difficult to describe in words. I think, in a sense, this is the meaning I can give these tapes. Besides, I use this material now for presentation. These are two groups. These are two groups, the shooting of which was taken at a distance of 1 month's time. Shooting was done at Borda Hospital with patients and patients' families. Within 1 month distance between both meetings, there were two groups I was in the list acquainted with. I was absolutely unaware of either the diagnostic they had been given or their backgrounds, nothing. And I get in touch with them as a group leader spontaneously like that. Well, this can be an advantage or not. You're right, of course. They're inconvenient, but in the case there's an advantage. Namely, you can spontaneously, mark my words, give birth to a climate full of confidence, dialogue, delving into personal matters you should sometimes need years on end before somebody dare talking about. Now, in a few moments, you have very interesting climates bursting out, endowed with a great therapeutic potential and a capacity to disalienating people, so to speak, so that mental patients at Borda do not look or talk like mental patients. At the very least, they look like, I should say, any run-of-the-mill neurotics like you and me. Well, that was kind of hurted. Well, before we watch the tape, and I think it will be a very meaningful tape, I would like to point out that Dr. Garcia Badaraco's thinking is so important that both videotapes have been translated into other languages and are about to be presented in Europe. Well, now, let's watch the beginning of the tape. Thereafter, Dr. Garcia Badaraco will give us some explanation. Okay, I think we have done some progress. It seems to me that the very thing is making clear how afraid of him you are and how you are afraid of your own mother. Doc says that you get nuts whenever you see her, or well, that may be due to fear probably, but now, since we are at it, we may be in a position to help you, your mother and you. She gets all worked up. Who knows if she does not know what to do with you? Or what is the effect you cause her? Well, but kids, you have to transmit them a sense of safety. You have to support them, to stand up for them. Of course, if and when you can do that. If and when, no. Yes, if and when you can do that. All right, when you can do that. And when you can't, well, won't you try and analyze? Well, but she's doing a therapy. You tell me right now, mark my word, she's doing a therapy. If you say so right now, we are doing a therapy. All of us, everyone. For your information, I'm also doing a therapy because I learn from you all. In other words, it seems to me that we are facing a similar set of problems likely to deal with facts we are mentioning now. Fine. We have just watched something showing the way you can have a group slowly starting to think. Do you want to add some comments? Well, what we're just talking about at times, relatives say bluntly to patients, hey, you crazy as a March hare, you're nuts, aren't you? So patients feel people are chasing them off, don't they? At a given moment, we have watched a patient, he was just talking, but his mother felt uneasy and she exclaimed, you're real nuts, you're no good. This is also a certain amount of violence. A kind of feedback into interaction, a kind of pathogen interdependence likely to make a pathology arise. I try to recontextualize this pathogen interdependence within a broader mental realm when I say, for example, that mother is afraid of her son's violence and most certainly son is afraid of his mother. So, talking about someone else's fear, that's a way to recontextualize violence in a more thinkable way. Violence hinders our capacity for thinking. Now, being afraid of violence gives us a possibility to think about violence. I think there is something remarkable here. When the young man says, well, she's not doing any therapy, and you answer, why? Tell me just what are we doing here? Exactly. We are giving at that moment a value to what we are doing, a privileged moment at that, where new, fresh things happen, where new capacities arise among patients, and patients evidence those new capacities they do not have at their disposal when violence pervades them and a pathogen feedback takes place. I think the next sequence we're about to see is a still better illustration about the topic of anger. Why, yes, because we can see that what we could call an increscendo infuriating process, and how an increscendo rage may generate a greater amount of disease as well. Your mom is afraid of you. She's afraid of your violence. But she gets on my nerves. She gets on my nerves until I burst out. Your mom is afraid of your violence. I think that you too are afraid of your own violence, and him too, and you too. You have just said you could snatch somebody's head off. Well, not really snatching the head off. Okay, that's a way of putting it. Anyway, that's a violent way of putting it. But that does just not justify my mother yelling at me, "You're nuts," each and every morning. Doc, about you said I would snatch somebody's head off. I didn't say that. You did. Well, okay, that is, if I have somebody that during 7 days a week, someone keeps yelling at me, "You're sick," at the moment I don't feel so sick, maybe is nobody going to believe me. Maybe I'm going to try showing her to which point I can get sick, so maybe I would hit that busybody. What this young man says is most eloquent. What's your opinion, Jorge? I think that what he says, what he explains about himself, is strongly linked to what other patients did say in this sense too. This we are not going to see because we try and synthesize. We are just showing some pictures taken from a sequence which is much larger but also takes more time. The interesting thing for us is that according to what this young man explains is, in my opinion, a kind of interpretation of how you fall ill or how you can manage so that someone else falls ill and reciprocally, and that is an unbearable situation, leading you to tell someone else that he or she is mad. Of both people involved, the most powerful person takes the weaker person to the hospital, but actually that's the very thing that we must change. And that is the thing I try to recontextualize by means of the present work, namely make people understand that going to a mental hospital is not to lock you up because you're transgressed. No, a mental hospital is a place you can live in, a place where you can think things up because madness lies among one's family and not at a mental hospital. I think this is a perfect description. Now let's keep watching the tape and see a sequence you call "Fury Stays Within." Indeed, that's something a patient says at a given moment, and as we're going to see it, I try my best to have people understand that fury, anger, rage, that can be considered as a part of disease, because fury is expressed, I should say, it is as if a patient was furious, and thus fury makes him or her mad. If you can understand disease, you can also recontextualize it. In other words, this is considered as forming part of a potential for health. That is, it's not fury itself that makes you falling ill. What makes you falling ill is the context wherein fury is generated. Fury is just its expression. Fury expresses a context that makes you falling ill. I want to ask something. Gustavo's mom, he was institutionalized last year, he came back this year, but by his own means. I think you mean on his own accord. Well, on his own accord, because he came in here. Well, yes, last year. That means he had good memories of this place. He liked it here. I don't know. Well, the first time maybe they somewhat forced him to enter or not, and then he was pleased. That's just it. That's what I'm explaining to your mother, so that she may understand that the fact you did come here is most positive. Positive for you, for her, for everybody involved. Fine. Why, sincerely, there are moments when I feel that he's the one who loses control what I'm going to do. If he loses control, what to do? But wait a sec, Gustavo. Why on earth does your mother say those things? Because she thinks that there are some aspects of yours she doesn't know well enough. That's all right. There are still things of mine she never knew. She still doesn't know you. Yes, I think that's right. I think there are a lot of things of mine she simply doesn't know. That's why she doesn't know me. That's why she never knew how to support me. All right, could be. And that's why, who knows, if we can't teach her one thing or two about you, Sonny, we may tell you how to know her a little more. Why did you say you had came here because it was the only place you could stay at, just to live here? All right, I'm going to explain. After the first discharge I was given, well, my family didn't want to get involved again, and I was not quite well when I left. I still had my, well, I felt terrible, quite terrible. The situation is that the place we lived at, Mom had to leave it and all that. I've already found a job, and so I could have gone and lived with her, but she did not want that. So she left us, my brother and me, where she lived. She just left. She just sold all the furniture and she just left her adrift. The thing it cost me more to accept, more than anything else, is that she abandoned me like that. I mean my own, she took away all that my girlfriend had given me. Well, my ex-girlfriend, really girl I had been dating with for 2 years, and I just felt abandoned. Well, that was awful for me. It was shocking for me to be discharged from hospital and being all alone on my own. And she told me, just rent yourself a room, start living on your own. But I was not prepared for that. I was not prepared as yet. I had fears, and well, I started hating her. I was full of resentment. I was as angry as can be. A lot of anger, you see. You saw it during the last meeting, but well, beyond all that, the guy who has to cope with everything, now that's me. Anger, I still feel, oh yeah, anger, I have it well inside me.
Pero igual tengo la bronca adentro, la tengo todavía, ¿no?
We have just seen those pictures about anger well inside me. I think that this young man's monologue makes the point, all right, how could you analyze it, doctor? I would like to point out that these young were just being acquainted with me because they had never seen me at all. And they started talking as if I were a lifelong friend. That is a climate which forms itself up little by little, a climate allowing that such deep things may arise freely. Anger well inside me, as he says, it's an expression meaning that obviously and quite frequently such vengeance feelings gripes you up, hindering a person to exert his or her healthy potential. He or she is a prisoner of anger, rage and fury, a prisoner of disease, a prisoner of resentment. Within our context, however, all this gets diluted, all this breaks into pieces. Now, there's a most interesting point, I mention it in my book, how you can break anger into pieces. It's quite interesting. That is, we're going to watch it now. I try and now pretend that the mother be in a position to understand that the anger, the resentment of her son, all of the things that make him sick are justified by all that happened to him, even though it's quite inappropriate for him to yell, I'm going to smash you up, or I'm going to do such and such things, and she's afraid of that, and so on. It's understandable. But understandable, I mean, you can think it over. Once you're in a position to think it over, DC starts drawing back. That's just it. No, I think our topic is the reunion. That reunion topic shows us, within a nice climate, how a time-honored fury can melt down and an affectionate meeting may take place, a creative meeting with all that it means, positiveness, emotion, healthy feelings, all of this within a nice perspective. Oh, let's have a look at it. Now you could think that when your parent, your mother as well as your father, were unable to support you, could you think it was so because they were not in a position to do it? Yeah, I bet they weren't in a position. His father was separated, my husband and I. Gustavo, he lived with his father for a little while. His father as a woman, he couldn't stand her. That's why he came here. We were living in a guest house. I brought him with me at the guest house. He lived me there for a while. Talk about the job. Oh, okay, I told him, come and live with me at the guest house. When you say, all right, Mom, I didn't interrupt you. Once he was angry, I don't remember why, and he told me, I don't smash you up because I'm here. Here, he meant at the guest house, do you see? What do you think, Doc? Am I not able to be afraid? He hit me. I'm going to smash you up or anything similar. That's an unsavory thing to say, but of course I'm afraid, and you're entitled to be afraid. That's logical. Anyone would be afraid. Violence is always frightening, but when you listen to... I think it's understandable. Should he say to me, I'm going to smash you up and so on, I would be afraid. And how? But when you listen to what he's saying, you start understanding his rage, don't you? So then, she's the one who doesn't want to understand that. She's still unwilling to accept it. She can't accept it as yet. When I'm angry, I spill it all over, and I say things that are no good. I can understand that, but the connection is so strong inside that until I calm down good and proper, I will not be able to say anything else. On the other hand, I think that this rage is going to calm down whenever I start to find again my way in life, because if I have a girlfriend who throws me over or leaves me and you say, well, that I must get things straight all by myself and all that, and all is piling up, well, I think like setting fire to everything around. I want to say a thing or two words at least. I have two children, Patience, Cesar, and Gabriela. I will let Gabriela do the talking because she was able to come here. She did an effort. She had to ask for permission at her job when she came here, and I think that I'm in the very middle of that. All that's listened to here, because the relationship between Cesar and me, well, let him tell it all about. Relationship was never friendly. It always took place among arguments, attacks, and I think when you have a closer look at things, who knows, maybe I'm wrong. Sometimes he created things on purpose just to get me mad. When things happen like this, I get mad at him, and we end badly. We do end badly. Who knows? I may be wrong. The two of them, they reproach me for doing things a father is not supposed to do. Not only Cesar, Gabriela also reproaches me for doing a lot of things she dislikes. Well, I would like to pass the mic over to them so that they say in their own words, because I definitely believe that they must speak by themselves. Can I drop it a word or two? I don't know you personally. I don't know him or anybody else. However, if I take into account all that has been said, okay, can be wrong. I repeat, I may absolutely be wrong, so please forgive me. That is, I put myself into Cesar's shoes. I repeat, I'm not acquainted with him. And so I would tell you, listen, Dad, if you feel that I'm trying to have an argument with you, you're right. But do you know why I do that? Because it's the only way to have you with me a little, a way for you to get busy about myself. And I only can achieve that by causing an argument between us. I may be wrong. I say strange things at times. You may think I'm crazy. Never mind. Go ahead, Cesar. Well, I think that all Dad said about arguments and all that bursted out at the time, I just felt terrible. All the brawls and all that I caused with yelling and arguments I had with him, that was with a double intention, right? That I did so that he either threw me out or realized things as they really were, and act accordingly. Well, that's the second time I come to the meeting. Those are my working hours, and well, I'm unable to come here because, well, you know how the situation is nowadays. A girl must take care of her job, and when I came here because my brother started working today, and well, in front of everyone here, I want to tell you that I'm proud of him, and well, I do not demonstrate my feelings a lot, but really I'm very fond of him. Can I say something? Hey, you too. Would it bother you too much to share this hugging and kissing with Dad? Don't you feel better now? I think that when you're in a position to hug and kiss, well, I don't know if you're in a position to hug and kiss right now, or if it's necessary for you to, well, another week, 10 more days, 1 month. Couldn't you please hug and kiss, all of you, and stop fussing? Just do it now. Hey, you go kiss your mom. There, go kiss your mom. Go kiss your mom too. Cesar with his father or his mother, I don't know him, but hugging and kissing like that, so affectionately like that, in their relationships with his mother and father, I never seen such a thing. And it called my attention that they could share such an emotion. I see that is very little I can do, because I think that as far as he's concerned, he doesn't know, he doesn't do a lot, so to speak. Maybe you cannot do too much, you on your own side, but here were a lot of people eager and willing to help him. The psychodynamism we have been in a position to observe during this sequence is most illustrative. I would like your comments in this connection. You can have lots and lots of comments, because there are both aspects, theoretical and technical, included, in which what we have watched, aspects emerging spontaneously, actually not necessarily spontaneous. In other words, this is not a spontaneous generation. It's in a way the way I have to conduct both a group and its dynamic, and this generates its phenomena. There's a moment when Cesar's father explains whenever Cesar provokes him, that drives him mad, so I tried and made the first move. And I said what Cesar could say, that is, if Cesar were not that ill, but nonetheless very much involved with his father's schemes. His father acts on him, and he acts on his father, and his father acts on him time and time again. We can observe a most evident pathological and pathogen interdependence. Why precisely I try to say is I'm going to insert something different, and I dare say it even though I say something you don't like, but it's with the best intentions. So I speak as if I were Caesar, so a touching situation is generated that quickly enough is spread among the group. That's the moment when they start hugging and kissing. So I suggest to brother and sister to hug and kiss, and as I observe that they leave their father apart, I suggest, couldn't you include your dad in the hugging spree? And there is when emotion springs. You can see that perfectly in that patient over there, the aggressive one, when he says he never saw something so touching. Yes, I've never seen something like that, he says. Now, we're dealing with two important topics, namely, the problem of sexuality. In my opinion, sexuality is always underlying among groups, and the problem of delirium. That is, delirium does not arise at the snapping of a finger. Delirium arises from reality. I understand that in that first meeting, those topics appearing by the end of the session are representative of topics likely to arise. In this case, however, I think we can show some interesting aspects. Will you analyze them when the tape is over? Some comments, yes. You talk about fear, and I was afraid several months afterwards. The other day when Salvador was at home, on Saturday he was perfectly okay. Now on Sunday he wasn't feeling well again. And at midnight, a quarter after midnight, he drops in my bedroom and he says, "Mom, I want to tell you something." And what he says, he's so horrible that I stayed awake until 4 a.m. Have an idea of what he did? Me, in time past, I prayed. I don't go to Mass and all that, but I stick to the Blessed Virgin that gives me a tremendous strength. After that, I took a half-leg sotanil and I did some yoga just to calm down. And I said to myself, how horrible a story about Dad, horrible, and Mom, all of that so disgustingly sexual. It was so definitely shocking. Well, he dropped in my bedroom a quarter after midnight. He was quite high. Dad hadn't had his heart attack as well. He had been to my parents. Salvador, my dad, can't stand him, so Salvador teases him. So a most disgusting story. Disgusting, absolutely. Mom was supposed to have had 6 children by magic. Dad was a sissy and he masturbated. I can't repeat all he said, and Salvador listened to me. And he started talking, so I told him, Salvador, go see a doctor. I don't act as a moralist, and I have always talked to my children, but there are things that, well, I'd rather not do. So I told him, Salvador, things are not what you say. Besides, Mom is a 77-year-old woman. Grandma is in good health. Well, yeah, but when he dropped in my bedroom at a quarter after midnight, I was afraid. And this persecutive delirium stopped right away. Mom must have talked to her brother and they got wise. That's the style of them, my uncles, I mean. They are kind of sick, they are kind of sissies, they have been shot at, they have been kidnapped. That is, I've acted, my mother doesn't want to admit it, and this is the basis for the problems with my mother. Some 2.5 years ago, they stopped teasing me. So I went to Elvira Hospital, and there to get institutionalized for a persecutive delirium. A persecutive delirium is cured right away, even though I had to call my mom for them to stop teasing me. My impression that all this is quite complex. In order to understand fully, we would need that we are going to need a special time. Let me do the talking, will you? But it seems to me that, as it is in every delirium case, that there is always a part of truth. Even though fantasies goes rampant in any delirium, delirium is always built upon a part of truth. Why do you say that? I've just told you is a delirium. No, I don't say what you have just said is delirium. I say that you were told it was delirium. So you say I'm right. Okay, but listen to me a minute. I said that delirium includes, at the very least, a part of truth. So, one part for you and one part for people say that it's plain delirium. Let me follow on a little. I can't say that all the things you tell are entirely true because I just don't know. That's the first time I listen to you, so give me a break. Let me tell you that. There's a part of truth in what you say, and we must acknowledge this part of truth so that, if possible, you're in a position to discover that part of fantasy you add to the part of truth. There's something related to your grandfather's sexuality. Well, a second. You don't know what all it is, and I don't want to get involved in that for the time being because it's most complicated. But I think all these things are related to and have been built up by you with all the fantasies children make up about adults' sexuality. Adult sexuality is seen from a child's eye, and that's what frightened parents so much. It's a part, so to speak, that makes parents so much afraid of their children. So we should help parents so that they are less frightened by children's sexuality. If not, we will be facing the problem she mentioned. What was your name, please? Oh, Gabriela. What Gabriela says, what food for thought. Unfortunately, the good aspects of few people could not be supported or accepted enough, and that's why the feeling of resentment, pain, suffering, thinking that you are no good, thinking that nobody understands, you make an appearance. Yeah, that's it. However, I think we can start the other way, because when you hugged and kissed a moment ago, I considered feeling were genuine, and from then on, if possible, we are going to build that could not be built before, and this is similar to other situations too. So, from now on, you will be in a position to build with your mother many things you were not in a position to build before. Well, yes, maybe, but she doesn't want to see it because their brothers are involved, and this is painful for her. Well, looking at the expression on her face, I should say that she sees much more than you think. There's a pal here, I ain't gonna his name, well, he doesn't feel like cooperating. Have a look at your mom, she understands. Well, I think you should go to your comment, because what we have just watched is very deep material, isn't it? What we have just watched, that mother telling us about her fears when her son drops in her bedroom, and this includes this topic on horror toward sexuality and the other topic you have deftly pointed out. That's the truth in the middle of delirium. That moment of the group meeting, when topics that arise or the way a patient such as Salvador speaks out, that's a moment quite embarrassing for all concerned, embarrassing and difficult, especially Salvador's mother, who, he points out that very aptly, who has been denying a lot of things that actually happened. The same thing her sons refer to, even though he does it in a very confused way, indeed a delirious way, but you can observe there's a part of truth in what he stands for. When we watch the following one meeting I take part in, that's in the second videotape, not this one, we can observe that whenever you let him speak, he gets more and more coherent, and you understand more and more to what he's aiming at. You get his hints. Now, let's not take into account some uncertainty I evidenced when I was talking to him. What I perceived that was he was mentioning some compromising things. He even gave names we have suppressed for privacy's sake. This teaches us that at times, when facing this kind of situation, you must control people. If not, they will promptly exaggerate, and they are likely to say things they will regret afterwards. They will repent and all that. In other words, you must set limits to enthusiasm, and both patients and patients' relatives, so that all of a sudden burst out and, so to speak, and strip too much in front of other people. You just pointed out a Trade Salvador mother's evidence. She was shocked and frightened at what her son was telling her, things she couldn't see, and that was reflected in or by the fear that her son could do her. Well, yes, in all that Salvador's mother described, that he dropped in her bedroom at midnight or later at 4 a.m., and that she was afraid of him, you can see she's afraid of the incestuous aspects they are both living at that moment. She's home alone with her son, and a father is lacking to get things straight. In that sense, you can detect a hidden, incestuous climate nobody speaks of, but everybody grasps, obviously. Now, all that Salvador says deal with sexual topics laden with a whole situation. He mentions his grandfather masturbation, this, that his grandmother yakety yak, and his mother is absolutely horrified, and she just can't listen to her son because she's dead scared. So I interrupt them and start talking about children's sexuality. That frightens parents. This is a universal topic, even though at that very moment it was quite far-fetched, because you would have needed some more time and comment what people just say to some more extent. If I interrupted sharp, the idea was to cool down things because they were heading to a general outburst. I see now about truth and delirium. As regard truth and delirium, I'm pulling his leg, so to speak, when patient says, "Why do you call that delirium?" And I reply, "Why? No, I don't say that you are delirious. That's the first time I listen to you. Why, no, I don't say that you are delirious. So I can't tell whether what you say is true or false, but I have an intuition." I think there's a part of truth in what you say. Thereafter, you will see how much truth is there, but anywhere there is a part of truth. Obviously, he has been diagnosed as suffering from a persecutive, as he says, delirium, but there's a part in what he says wherein he most surely refers to life events that have impressed him immensely, and life events that are related to child seduction, rape attempt, and these kind of things. Okay, so to conclude the first part of multifamily groups, we are going to watch Are We Born Mad or Do We Become Mad? And Dr. Garcia Badaraco will give us his final comment. I would like to ask you if we are born mad or we become mad. My, what a question. Say, you were already mad when you were born, Me, I wasn't, but they drove me mad. Did you ever see a mad baby? And why am I all alone here? No, I've never seen one. So, there is no such thing as mad babies. We are not born mad. With the milk, when they give the baby his formula, they have baby becoming mad. But they drove me mad. And if they drove me mad, why on earth am I here at a mental hospital? And who drove me mad? People drove me mad. People. With all the things we are talking about here today, I guess we are replying to your question, don't we? That is, instead of somebody believing that he can say no because mental illness comes from that and from heredity and all that, we are learning now, all of us, what's the very thing, sharing madness, a little sort of patient mother speak. When he came in here, I was feeling awful. Here he's normal. When he comes back home, he's completely normal. The only bad thing, he feels awful because his wife and him are separate. He has kids at school. He has also a daughter, but well, she's not her daughter. She's 15 years old. He has got problems, but he lives with me. Well, now he's discharged from here, completely normal. He is at that point that he could work as a taxi driver, but afterwards, on account of problems or because he doesn't take his medicine he's supposed to take, his head starts working, he gets out of his depth, he gets and he comes back here as he's no crackers. Talking as he talking now, but as soon as he starts taking his medicine again, he starts normal again, but completely normal and not bad. The only thing is that he froze up his medicine. So now the taxi, he's not going to drive it again. He's going to take his medicine and stay here all the time he needs until he's discharged and he feels completely good. I'm the one who lives with him because I'm the one who has him at home. So that's why I take him here, because I know that here he's well again. He's well again, but he's not to go out presto. He will go out when he's quite well, and his medicine he's going to take it when I'm home, because I'm the one in command. Really, when we watch this first presentation Dr. Garcia Badaco has brought us with so eloquent pictures, I think we learn a lot, not only from a technical or a theoretical point of view, but also this tape, because this tape clearly shows how interactions happen among the different groups. Jorge, to conclude this first cassette, how about commenting a little on, are we born mad or do we become mad? Well, yes, it is the Spanish patient, Angel Luis, had taken the opportunity he had to display his main problem, namely, his mother is, damn it, in command about everything. She rules him with an iron hand, she puts him in, she puts him out, she takes him out, she's going to force him to comply with his treatment until she says otherwise. And of course, such a display of authority must have had an ominous influence on Angel Luis since he was a child. Actually, these are repeated or updated traumas we have been in a position to observe between Angel Luis and his mother. Now, what's interesting is when he asks, are we born mad or do we become mad? He gives us an opportunity to take this problem into account and show us that at that moment nobody would be interested in discussing what mental disease is, how theoretically mental disease is produced, what is madness. At the same time, we will be in a position to speak about things that are happening to us and so try and learn what really madness is. Because once we have learned by observing from life, madness should have disappeared. That's what I say at hospital. That is, whenever madness is shared among people, madness stops being madness. I think this is the best way to synthesizing this tape. There's an interesting detail. One patient says, if they drove me mad, why am I alone here? Well, the idea was setting up a get-together with patients and their families and a family with other families representing the social context we live in. So all the dimensions we need to work are there, so that the patient is in a position to achieve a therapeutic process aiming at a true rehabilitation. Hence, we must reject the idea that Spanish woman, Angel Luis' mother, represents with her so primitive way. She's so primitive that she's a lot of fun in the end. She just states, he's going to stay here until I say otherwise, and he's going to take his medicine, etc. As if you could put mental disease in a bag, lock it up into a box. Actually, what she does is plainly fattening, so to speak, mental disease. She produces mental disease without getting aware of it. So it's interesting to see that our work mainly consists in running to the rescue of symbiotic pathological couples we detect so clearly among those groups. Take each member out of this symbiotic pair and putting him or her en route to a possible individuation. If not, madness will keep being madness. And this is clearly seen here, is of its own nature a shared paranoid disorder, good old folie à deux. Well, we have watched the first videotape. I hope that whoever watched it will be interested in watching the second tape so that we may continue presenting multifamily groups. See you at the next presentation.